Good afternoon. This hearing will come to order. I want to welcome everyone to today's hearing. Earlier today, we had the opportunity to hear from Secretary Shulkin about the administration's budget priorities for the Department of Veterans Affairs. Now we will examine how VA actually manages the money that taxpayers provide. Many of the numbers involved are astoundingly large, and the audit speak can be confusing. But the core of the issue is very simple. The VA Chief Financial Officer must move the right amount of money from point A to point B at the right time. The CFO must have strong internal controls, effective employees, and IT systems that work in order to accomplish that. We will hear about VA's fiscal year 2016 financial report, and the Office of the Inspector General will present its audit of those financial statements. OIG and the Government Accountability Office will explain their work on the troubling issue of improper payments. The American Legion will also share its observations on VA's debt collection practices. The department has a troubling number of weaknesses and deficiencies in internal financial controls. First, persistent IT security weaknesses are, unfortunately, well known to this committee. The financial IT systems are inadequate, obsolete, and potentially only a few years away from complete failure. However, the problems go well beyond IT. The CFO organization is weak and hobbled by fragmentation. VA struggled to account for its education, mortgage, compensation, and pension liabilities. For years, VA has had difficulties in obligating and deobligating funds, especially in the areas of community care and undelivered orders. In other words, VA has a hard time estimating how much a purchase will cost, setting aside the money when it will be needed, and then reclaiming the unspent money to use for other purposes. Billions of dollars are often tied up on the books, unavailable for the intended use. Last year, VA had about $5.5 billion in improper payments. An improper payment, as our fine witnesses will explain, is one that should not have been made, is the wrong amount, went to the wrong person, was made for items not received, or lacks necessary documentation. Not all improper payments are lost, but they represent a significant amount of government waste. VA has never been able to fully comply with the Improper Payments Elimination and Recovery Act, and the improper payments are forecast to continue rising. VA deserves credit for its transparency on improper payments. But beyond transparency, I look forward to hearing a credible plan to solve the problem. Finally, sometimes benefits are paid out incorrectly, and recouping those improper payments necessarily entails debt collection. VA's Debt Management Center in St. Paul, Minnesota does the work. In most instances, especially when the improper payment is through no fault of the veteran, the Debt Management Center operates flexibly and constructively. VA policy is not to charge interest on these debts. However, after a payment is delinquent for 120 or 180 days, the law requires VA to turn it over to the Treasury for collection. The Treasury operates much more aggressively and adds interest and fees that can be substantial. This debt collection system must operate to the highest standard. Administrative errors have grave consequences for veterans and their beneficiaries. In conclusion, members of Congress and presidents of both parties have demonstrated a commitment to funding the benefits our veterans have earned. But no matter how many resources are provided, if the dollars are mismanaged or wasted, VA will not succeed in its mission. I now yield to my friend, colleague, Ranking Member Custer for her opening remarks.
Thank you, Mr. Chairman. Good afternoon and welcome to the Oversight and Investigations Committee This afternoon's hearing is an opportunity to discuss current issues facing VA financial mismanagement or management. VA's financial management system is of critical importance to the VA, especially VA healthcare. The VA relies on these systems to account for the procurement of needed medical and surgical supplies, prosthetics, adaptive sports equipment, which are critical to a veteran's quality of life, and VA's extensive community care programs that we have discussed so frequently in our committee. Year after year, the VA fails to fully comply with the Improper Payments Elimination and Recovery Act. And year after year, this committee struggles to ensure that the VA has the funds necessary to provide veterans with the benefits and care they have earned. We know that in FY 2015, $5.5 billion in improper payments were made, which went mostly to providing veterans care in the community. But this is unacceptable, and we need to get this under control. I will have some questions today, however, about the definitions so that we all have a common understanding of what how those funds were expended. The issues facing the VA's financial management system are complex, and I appreciate the opportunity to gain insight from the expert witnesses assembled today from the VA, the GAO, the IG, and the American Legion. As you are all aware, this morning our committee heard from Secretary Shulkin about the VA's proposed budget. With VA's financial management challenges, I'm concerned that the VA is unable to properly forecast its requirements, which contributes to VA's many challenges that we discussed in our hearing this morning. Toward the end of last year, the VA announced its selection of the Department of Agriculture as its federal shared service provider. While I understand that selection of an FSSP can allow a department to better focus on its mission and replace its 50-year-old financial management system, I'd like more details on the costs and implementation of this shared system and whether this will meet VA's needs going forward. VA's IT system is the backbone of the organization. All too often, this subcommittee discusses the lack of IT infrastructure when we are discussing the agitating factors that led to a particular crisis. The VA's partnership with the USDA seems to be a move in the right direction, but the VA's financial IT system is not the only cause, as the chairman has mentioned, for the VA's faulty finances. As in many other departments, the VA's chief financial officers operate under piecemeal protocols and cannot follow recommendations intended to remedy complex and expensive problems within the system. I hope to learn more about these weaknesses within the VA from our witnesses. The GAO and IG have completed multiple investigations into the VA's improper payments and financial structure. However, the VA has not always agreed with the recommendations made by the agencies, and today I hope to hear about why that is. We've been asked to pass legislation that would allow VA to enter into provider agreements and other contracts that do not require compliance with certain parts of the federal acquisition regulations. Well, in some circumstances, this appears to be the best solution. I also know from previous hearings that VA's failure to follow policies, its broken promises, and lack of oversight still contribute to many of VA's challenges, and I'm not convinced that simply passing such legislation will solve this problem. I look forward to the discussion ahead of us this afternoon so we can get VA's financial management program on track so that it can support the important VA mission to get veterans the benefits, care, and support they so desperately need and deserve. So thank you, Chairman Bergman. I yield back the balance of my time.
Thank you, Ranking Member Custer. I ask that all members waive their opening remarks as per this committee's custom. With that, I invite the first and only panel to the witness table. On the panel, we have Ms. Lori Park, Deputy Assistant Secretary for Finance in the VA Office of Management. She is accompanied by Mr. Mitchell Sturm, Acting Deputy Chief Financial Officer for VBA. We have Ms. Burl Davis, Director of Financial Management and Assurance for GAO. We also have Mr. Nick Dahl, Deputy Assistant Inspector General for Audits and Evaluations. He is accompanied by Ms. Sue Schwendeman, Director of OIG's Financial Audit Division. And we have Ms. Julie Larson, Team Leader for Debt Management and the Pension Maintenance Center at the American Legion. I ask the witnesses to please stand and raise your right hand. Do you solemnly swear, under penalty of perjury, that the testimony you are about to provide is the truth, the whole truth, and nothing but the truth? Please be seated. And let the record reflect that all witnesses have answered in the affirmative. Ms. Park, you are now recognized for 5 minutes.
Good afternoon, Chairman Bergman, Ranking Member Custer, and members of the subcommittee. Thank you for the opportunity to discuss the actions the Department of Veterans Affairs is taking to improve financial management. As a VA Deputy Assistant Secretary for Finance, I am responsible for the department-wide financial management activities. I am here today with my esteemed colleague, Mitch Sturm, Acting Deputy Chief Financial Officer for the Veteran Benefit Administration. Over the last several years, through an improper payment reviews, insights from the Office of Inspector General reports, and detailed deep dives into root causes of audit findings, it has become clear that the foundation of our financial management practices is failing us. We have based our day-to-day acquisition and financial management processes on a fragile network of systems that routinely require our workforce in the field to rely upon manual double-entry processes, complex workarounds, manual reconciliations, and procedures that cannot keep pace with current financial management requirements set forth by the Office of Management and Budget and the Department of Treasury. Efforts to remediate these complex issues within our current foundation, coupled with a workforce that has not yet been trained in best practices, has limited our progress. VA must focus on modernizing our financial management and acquisition systems, strengthening our internal controls, re-engineering business processes, and investing in a trained workforce. Recognizing these challenges, we have recruited talented financial management professionals, seasoned project managers, experienced data architects, and a strong leadership team to lead initiatives that will improve financial management at VA. Examples of this important work include, in October of 2016, we kicked off VA's Financial Management Business Transformation Initiative. This agency top priority brings acquisition, financial, information technology, supply chain, and frontline healthcare and benefit experts from across the department in collaborative sessions to transform the way that VA does business. This multi-year effort will standardize, integrate, and streamline financial management and acquisition processes within the Department of Agriculture's shared service solution. My office is charged with the responsibility to spearhead a new department-wide effort, the Financial Management Training Initiative, providing education to financial management and acquisition professionals across the department through a centralized and standardized curriculum. An important aspect of this initiative is the partnership between financial management and acquisition professionals, which is needed to address many of our complex challenges and support VA's financial management business transformation. In the last 10 months, we have held both virtual web-based and in-person events where VA employees participated in a total of 71 separate classes. 2 more events, one virtual and one in person, are planned over the next 9 months. Over the past 3 years, VA has completed a deep dive review of over 75 programs to identify internal control failures that result in improper payments. This led to a significant increase of VA reported improper payments. Currently, the legislative improper payment definition includes any payment that experienced an error during the acquisition or payment process, as well as those made to the wrong person, the wrong amount, and where services were not received. This results in many payments being reported as improper, even though the government has not lost money. Currently, we estimate that 90% of our $5.5 billion reported improper payments do not represent a loss to the government and cannot be recovered. Further, about 80% are attributed to errors in the acquisition process, specifically in our programs providing care in the community because a contract did not exist that followed federal acquisition regulations. While we are committed to recovering identified losses, VA can only collect payments that have been specifically identified during an internal review process. VA cannot collect on a projected amount of improper payments, even a loss, because the payees or documentation supporting a collection cannot be identified or created from a projection. Debt collection is also an essential part of a strong financial management where VA is making improvements. VA balances veteran debt collection and a strong sense of compassion, as well as compliance with federal debt collection statutes and policy. We have collaborated closely with veterans and veteran service organizations to understand the challenges facing veterans when a debt exists. Our approach includes educating veterans on strategies to avoid debt, understanding the debt collection process, and leveraging options when a debt is established. Even with these many efforts, VA recognizes it has many challenges to overcome, while at the same time providing veterans the benefits and services that they have earned and deserve. VA acknowledges its current challenges and audit findings in financial management that reflect a need for improved financial stewardship. We believe that the initiatives that we are working on will improve VA's financial management and better serve our veterans. Thank you for the opportunity to appear before you today and for your continued support of the veterans. I look forward to your questions.
You got to turn the microphone on first. It's not voice activated. Thank you, Ms. Park. Ms. Davis, you're recognized.
Chairman Bergman, Ranking Member Custer, and members of the subcommittee, I am pleased to be here today to discuss the issue of improper payments at both the government-wide level and at the Department of Veterans Affairs. Improper payments remain a significant and pervasive government-wide issue. For several years, GAO has reported that the federal government is unable to determine the full extent to which improper payments occur and to reasonably assure that actions are taken to reduce them. Since fiscal year 2003, when certain agencies began reporting improper payments as required by law, cumulative government-wide improper payment estimates have totaled over $1.2 trillion. For fiscal year 2016, agencies reported improper payment estimates totaling over $144 billion, an increase of more than $7 billion from the previous year's estimate. For the same year, the Department of Veterans Affairs reported an improper payment estimate that totaled $5.5 billion, an increase of about $500 million from the prior year. The VA improper payment error rate was 4.5% of related program outlays. The VA Community Care Program reporting a $3.6 billion in improper payments, and the Purchase Long-Term Services and Support Program reporting $1.2 billion in improper payments accounted for about 87% of VA's estimated improper payments for fiscal year 2016. These two programs also had the two highest error rates government-wide in that fiscal year, with error rates of about 76% and 69%, respectively. VA has not developed improper payment estimates for all of the programs and activities it has identified as susceptible to significant improper payments. For fiscal year 2016, VA did not report improper payment estimates for 4 such programs. Because VA did not report estimates for these programs, its overall improper payment estimate is understated, and the agency is hindered in its efforts to reduce improper payments in these programs. Strong financial management practices, including effective internal control, are important for federal agencies to better detect and prevent improper payments. The VA faces significant financial management challenges. In 2015, GAO designated VA healthcare as a high-risk area because of concern about VA's ability to ensure its resources are being used cost-effectively and efficiently, and to improve veterans' timely access to healthcare and to ensure the quality and safety of that care. In addition, in VA's fiscal year 2016 agency financial report, the independent auditor cited material weaknesses and significant deficiencies in the design or operation of internal controls over financial reporting. To reduce improper payments, VA can use root cause analysis to identify why improper payments are occurring and to develop corrective actions. According to VA's fiscal year 2016 agency financial report, the root cause for over 3/4 of VA's improper payments was program design or structural issues. To reduce the amount of improper payments in this area, VA stated that it will make the procurement practices more compliant with federal acquisition regulation provisions. In addition, to help reduce improper payments, VA can complete its implementation of GAO's recommendations. VA pays billions of dollars to millions of disabled veterans. Thus, accurate claims decisions help ensure that VA is paying disability benefits only to those eligible for such benefits and in the correct amounts. However, 2 GAO reports have found problems with how VA processed its claims to reasonably assure the accuracy of or eligibility for the disability benefits, increasing the risk of improper payments. For example, in a November 2014 report, GAO found that VA had, among other things, shortcomings in its quality review practices that could reduce its ability to ensure accurate and consistent processing of disability compensation claims decisions. To date, VA has implemented 6 of the report's 8 recommendations and expects to implement the other 2 later this summer. In conclusion, in light of VA's significant financial management challenges, we continue to be concerned about VA's ability to ensure its resources are being cost-effective and efficient. It is critical that VA take actions to reduce improper payments, especially given that VA's payment amounts are likely to increase in fiscal year 2017. While VA has taken several actions to prevent improper payments, further efforts are needed to help minimize the risks of improper payments across its programs. Chairman Bergman, Ranking Member Custer, and members of the subcommittee, this concludes my prepared remarks. I look forward to answering any questions you may have.
Thank you, Ms. Davis. Mr. Dahl, you are now recognized for 5 minutes.
Mr. Chairman, Ranking Member Custer, and members of the subcommittee, thank you for the opportunity to discuss our work regarding VA's financial management. I will focus on the results of the FY 2016 audit of VA's consolidated financial statements and our work related to IPERA. As mentioned, I'm joined by my colleague, Sue Schwendeman. Effective financial management is important because it enables an agency to plan, direct, monitor, and control its financial resources. The CFO Act requires the OIG to conduct an audit of VA's financial statements. We contracted with the independent public accounting firm Clifton Larson Allen to perform the audit. Although VA has received an unmodified or clean opinion on its consolidated financial statements from our contracted auditors, VA has continuously faced challenges in achieving that result. A clean opinion means the financial statements are presented fairly in all material respects in accordance with accounting principles generally accepted in the United States. It does not, however, mean VA easily obtained that opinion or that VA does not have internal control weaknesses. The most recent audit of VA's financial statements identified 6 material weaknesses and 2 significant deficiencies, which was 2 more in total than the previous year. A material weakness is a deficiency in internal controls such that there is a reasonable possibility a material misstatement will not be prevented or detected and corrected in a timely basis. 3 of these material weaknesses are repeated from the prior year's audit, including information technology security controls, community care obligations, reconciliations and accrued expenses, and financial reporting. 3 others were new material weaknesses. First, education benefits accrued liability. For this, CLA reported VA did not use the appropriate method to account for veterans' education benefits and therefore did not report an estimated liability for future benefit payments until FY 2016. Second, the control environment surrounding the compensation, pension, and burial actuarial estimates. After VA's chief actuary retired, CLA noted the lack of succession planning to replace the actuary who was responsible for calculating VA's unfunded veterans' compensation and burial liability, which totaled over $2 trillion. Third, the CFO organizational structure for VA and the Veterans Health Administration. CLA elevated this from a significant deficiency to a material weakness and reported VA's decentralized and fragmented organizational structure for financial management and reporting did not operate in a fully integrated manner. CLA also reported 2 significant deficiencies, which are deficiencies in internal controls less severe than material weaknesses, yet important enough to merit attention by those charged with governance. First, procurement, undelivered orders, accrued expenses, and reconciliations. CLA reported issues concerning reconciliation among various procurement systems and VA's financial management system, VA's extensive use of miscellaneous obligating documents, the lack of an adequate process to validate estimated accrued expenses against payment data, and procurement issues such as untimely liquidation of undelivered orders or the untimely recording of contracts in FMS. Second, VA's loan guarantee liability. CLA reported the Veterans Benefits Administration needed to revise certain model assumptions used for estimating future cash flows and determining the cost of its loan guarantees for financial reporting purposes, which led to a reduced reported liability. Overall, CLA reported VA's legacy financial management system no longer met increasingly stringent and demanding financial management and reporting requirements. CLA made recommendations to address identified issues. Additionally, VA is currently working with the U.S. Department of Agriculture as a shared services provider to obtain financial services. In FY 2017, VA began efforts to standardize business processes and identify changes required for this system's modernization effort. Last week, we issued our annual determination on VA's compliance with IPERA. We reported VA did not comply with 2 of OMB's 6 IPERA requirements, specifically that VA did not maintain a gross improper payment rate of less than 10% for the VA Community Care Program and the Purchase Long-Term Services and Support Program. And also, VA did not meet reduction targets for 6 VHA programs. We made several recommendations to agency leadership to take steps to reduce improper payment rates, achieve reduction targets, and improve improper payment estimates. In conclusion, VA's financial management and system challenges are many and complex. VA plans to move to a shared services provider to gain access to modern technology, but VA will need strong organizational leadership and coordination or cooperation to manage this significant change. Mr. Chairman, this concludes my statement. We would be happy to answer any questions you or other members of the subcommittee may have.
Thank you, Mr. Dahl. Ms. Larson, you are now recognized for 5 minutes.
Chairman Bergman, Ranking Member Custer, and distinguished members who proudly serve on this subcommittee. On behalf of Charles E. Schmidt, the National Commander of the largest veteran service organization in the United States, representing more than 2 million members, it is my duty and honor to present the American Legion's position on this important issue regarding veteran debt and collection and assist the committee in understanding the Department of Veterans Affairs debt collection process, and highlight areas of improvement, as well as provide insight into how the American Legion assists the veterans in these matters. I am the American Legion's subject matter expert on debt collection within the VA and work at the VA's regional office in St. Paul, Minnesota. There I assist veterans who have incurred debts. Often these debts are being collected from VA benefits or other sources of income, such as tax refunds. Older debts are referred for collection to the U.S. Treasury Department, which will employ collection methods such as garnishment of wages or Social Security benefits. Once a debt is owed to the VA, the case is referred to the Debt Management Center for collection. The DMC sends the claimant a letter detailing the reason for the debt along with the amount due. It also provides information on repayment options and requesting a waiver and rights of appeal. If there is no response to the letter within 30 days and the person is receiving VA benefits, the VA will recover the full amount of debt from those benefits. In cases where an individual is not receiving VA benefits, demand letters will be sent and credit agencies are notified. Eventually, these debts will be referred to the U.S. Treasury Department for further collection action. There are a number of ways that the American Legion tries to assist claimants. For example, we help explain the process to the claimant and inform them of their options. We will request additional information from Debt Management Center staff to develop a repayment plan. Additionally, we will contact the regional office staff if their debt appears to be erroneous. I would like now to share a few case scenarios with you. A case where the daughter of a veteran incurred a $16,000 overpayment because she was incorrectly receiving death and education benefits when she was not entitled to receive both. She had applied for a waiver on time, but because her request was misplaced, the waiver was never processed. As a result, DMC garnished her entire $8,000 tax refund in order to recover a portion of the debt. I later learned that the daughter had a delivery confirmation from the U.S. Postal Service verifying that the waiver request had indeed been received by the VA. Fortunately, in this case, the VA granted the waiver due to the financial hardship, and the $8,000 was later refunded. The next case concerns a homeless female veteran who incurred a large debt after the VA removed her dependents from her benefits retroactively to 2005. Due to her homelessness, she was unable to receive the VA's letter advising her of the debt. Because she was unaware of her options such as a repayment plan, DMC began recovering all of the debt from her compensation. This went on for about a year before we intervened. What made matters even worse for this female veteran, and if being homeless wasn't hard enough, she also had to deal with her vehicle being repossessed. Fortunately, we were successful in getting 2 months of her benefits refunded and a small withholding set up. I'm pleased to report that her benefits were restored completely and she received a retroactive payment. As you all well know, the VA system is complex and difficult for many veterans to understand. In both examples that we have shared with you, the primary issue is how the VA collected and processed debt information. Letters sent to homeless veterans were returned and a debt was incurred. Veterans who submitted requested information never made it to the Debt Management Center. These are areas we feel the VA can improve upon. Fortunately, the American Legion and other veteran service organizations maintain staff in every regional office to aid veterans and their dependents with claims and other VA issues such as debts. We specialize in identifying VA errors and solving problems for veterans and their families. Thank you.
Thank you, Ms. Larson. The written statements of those who have just provided oral testimony will be entered into the hearing record. We will now proceed with questioning. I will yield myself the first 5 minutes. Ms. Park, I would like to start with the headline here, quote, "Community care and purchased long-term services and supports have the highest improper payments in the federal government," end quote. About $3.5 billion and $1.2 billion of overpayments respectively. I understand VA's position that most of this money is not necessarily misspent, just designated as improper because it is not backed up by bona fide contracts. VA categorizes about $3.3 billion and $900 million that way. Can you assure me and all of us that none of that money is wasted?
So thank you for the question, sir. So during our testing of those two programs, Community Care and PLTSS, our testers do sample and they dig into the actual, do we have the proper paperwork that supports those payments? Did they get to the right place, the right amount? Were they paid the Medicare rate? So yes, I can assure you that they were correct.
So, yes or no, regardless, is it fair to say a payment that lacks a bona fide contract could also be made in the wrong amount or sent to the wrong place?
So when you talk about the huge number of payments that we have, I think there's always opportunity for something to go wrong. However, during our sampling, we found that the payments were made to the right person for the right amount.
Ms. Davis, putting aside this issue of contracts or no contracts, there is still about $200 million and $300 million of overpayment in the two programs respectively. Can you tell us about what they are?
Cannot speak to what they are. I can state that in addition to the structural issues that have been referred to regarding the two programs, community care and purchased long-term services and support, there are a number of improper payments that are made in the compensation program, and those are due to administrative errors. This is based on information that is provided by the agency itself as to how it is categorizing its improper payments using the categories that are established by the Office of Management and Budget.
Thank you. Mr. Dahl, OIG rejected the improper payment estimates VA submitted for two programs, VHA purchasing of supplies and materials at the post-9/11 GI Bill. VA said the improper payments were $22 million and $3.9 million respectively, and OIG said they were $78 million and $250 million respectively. That's a huge difference. Can you explain how OIG came up with its numbers?
What we did was questioned the depth of the testing that they did when they were verifying those payments. And we found that, for example, with the post-9/11 GI Bill, that they weren't verifying the tuition charges against, in the old days, I guess it would be a course catalog. Today, it might more likely be something posted on a website. But they didn't, in our opinion, they didn't independently validate that the tuition that they were billed was proper. So that was why there was such a large delta there.
Ms. Park, would you like to comment on that?
Sure. For the supplies and materials, so the supplies and materials issue actually ended up being that when the IG actually sampled, they were looking for precise fee schedules that actually matched the time in which we were invoiced from someone. Here in the community for a supply, I'm sorry. So for a supplier. So what we found was, because of the disconnect between our acquisition and our financial systems, we couldn't make that link. We didn't have a record that we could actually demonstrate to the IG that we had actually paid the right amount for those supplies. So that was generally the issue. I can defer to Mitch about the education.
Thank you. Yeah, for education, we did go back and look at 30 of the samples the IG pulled, and they were right. We were not verifying back to the old catalog. Of all 30 of them were proper. But because we didn't have the proper support, the IG determined them to be improper for this review. So we're going to expand our testing for next year and this year to include that look at those catalogs or online websites.
Thank you. I see my time has expired. Ranking Member Custer is recognized for 5 minutes.
Thank you, Mr. Chair. I want to follow up on this whole issue about the improper payments, because I have a concern about expectations going forward based on the White House budget presentation. The White House has stated the budget will save the American people $150 billion in improper payment savings. And we've discussed here today that according to the 2016 agency financial report, the VA issued over $5.5 billion in improper payments in FY 2016. $5.3 billion of this is overpayments. But Ms. Park, your testimony is that 90% of that cannot be recovered. And would you please clarify for my colleagues and for anyone watching this hearing, this whole issue about the contracts in the community care programs, because we have a serious disconnect. If the White House is assuming that these funds can be recovered, and in fact, we're not going to go back. These services have been provided. We're not going to go back out into the community, I hope not, in my district, and take these monies back from rural hospitals that barely get by. So could you explain the reality of this situation?
Yeah, I'm very happy to do that. So take the example for a veteran receives care in the community where there is no federal acquisition regulation-based contract exists. They're going to get care in the community. What our sampling and testing has indicated that this payment was for the correct amount to the right person. We verified the rate, but because the provider agreement was not based on a FAR contract, it is improper. According to the improper payment rate, we should be able to go back to that provider and collect that payment. And that's something that we don't want to do because we did receive a service, the veteran was helped, so we're not going to move forward with those collections.
Think you very much, Ms. Park. And I just want to say to Ms. Larson, you broke my heart. I cannot imagine that the U.S. government, through the VA, goes after a homeless woman because of some retroactive change in her benefits that she knew nothing about, and takes money out of her paycheck and repossesses her car. So I certainly hope we don't go forward with going after rural hospitals for services that have already been provided. All right, so we're going to move toward this USDA financial product. I'm sorry, I don't have the correct term. And the VA, how is this going to help with payments of veterans benefits, medical center operations, non-FAR-based contracts? I feel like we're going to be back here for another hearing another day. So help us understand how this is going to get better. And is there anything that we could do to help with legislation? If these community care contracts are not going to be FAR-based contracts, let's not put them under this improper payment category. Let's define it some other way.
So when we talk about moving to a federal financial system and how it's going to actually help us with the issues that you've seen. So the way VA is different than when you look at for most big departments. They will have a singular financial system where they do all of their accounting activities. So I'm talking about status of funds, funds distribution, obligations, contract ordering, payments, accounts receivable. So VA built things way differently, and it started out a program area. So they built programs like Care in the Community, veteran benefit programs, the education programs. They built systems to meet those needs, and then they slapped accounting on top of it. So that causes all these disconnects. That's why we rely so heavily on these reconciliations between systems out in the field. So what we're going to do with a new shared service provider, just like every other federal government agency, we're going to put that finance stuff into one financial and acquisition system that's already integrated. So we're not going to have the fat fingering in between systems and all the reconciliations that occur. So that'll give us not only visibility into our financials, but it's also going to resolve a lot of our issues. So it'll also make your programs more efficient, I believe, as well.
Yeah, I appreciate it. My time is up. I do think we're going to have to deal with this community contract issue. And I just want to say for myself, having worked for many, many years with hospitals and hospital economics, the quote that I've heard over and over is hospital economics are where the rubber meets the blue sky. So good luck with keeping track of how these dollars are spent. Thank you. I yield back.
Thank you, Mr. Poliquin. You're recognized for 5 minutes, sir.
Thank you, Mr. Chairman, very much. Ms. Park, let me ask you a couple questions. I want to make sure I understand this. The VA contracts for goods and services, whether it be providing health care for our heroes in a community setting or to buy Band-Aids or aspirin, correct?
Yes, sir.
Okay. And any time you use those or you don't use those monies, you return them to the United States Treasury, correct?
Well, in some cases, there are some authorities where we're allowed to keep the money, but generally,
Okay.
yeah.
And in 2016, there was $4.2 billion of funds that were contracted for various purposes that were unused by the VA. Is that correct?
I am not familiar with that number, sir.
Okay, well, that's the number I have here. But there's a lot of money every year that goes back to the U.S. Treasury. We appreciate it so the taxpayers don't have to spend it because it wasn't used for whatever purpose it was supposed to, right? Do you tell this committee how much money in each category was unused so we don't have to appropriate the money to you every year?
So through our financial reporting, that information is available. I don't have it on hand right now.
Okay, so I want to make sure I understand this. So your budget is $185 billion this year. That's what the president's asked for, okay. And 6 years ago, it was 50% less. So it's gone up 50% from 120 to about $185 billion in 6 years. That's a lot of money. We want to make sure it goes to our veterans, okay? So I want to make sure I understand this, is that when money is appropriated to the VA but not used, you send it back to the Treasury, but you don't tell this committee that it was unused in a specific category, so we don't know if we should appropriate that amount of money to you or not. Is that right?
No, I don't agree with that statement at all.
Okay.
So first of all, there are many different appropriations that govern the way that we do business at VA. And a lot of those appropriations are know-your accounts, and that money doesn't expire. So that's put that aside. For money that is expired, we do report that through our financial management
Here's what I'm trying to get at, Ms. Park.
reporting.
Is there a way that you can tell us beforehand, before the budgeting process, or the executive branch, you're in the executive branch, the White House, such that money is not appropriated to you that you don't use, and then you send it back to the U.S. Treasury? Can we avoid that step to make sure we don't lose any of that money, and to make sure that we're budgeting properly?
That information is reported to the Department of Treasury on a monthly basis.
Okay, but we appropriate it. Is it reported to us?
I assume you guys get the Treasury reports, but we're happy to give you that information.
That'd be great. Okay, thank you very much. Let's move on to something else. Improper payments. I want to make sure I understand this. Ms. Davis probably be the person I should ask. Did I hear this correctly, that since 2003, which is roughly 15 years, over I almost can't say this, $1 trillion of improper payments have been made throughout federal government?
Over $1.2 trillion.
$1.2 trillion
have been estimated.
And this year alone, 2016 alone, last year was about $140 billion?
Yes, reported as estimated.
Okay, and we found out about that because of audits that we're doing. Is that correct?
It comes from the agency's financial reports on an annual basis, and we at GAO have accumulated those statistics.
Okay, and at the VA, it was $5.5 billion, right?
Correct.
Okay, I come from a state in Maine, and we have an annual budget in the state of Maine, annual budget of about $3.5 billion. This is $5.5 billion of improper payments. This is about 70% larger than our entire state budget. And then I see something right here, a request from you folks saying that you want to now discontinue the use of outside auditors when it deals with improper payments and do it internally. Why in the dickens would we trust you people to audit yourself internally when you can't keep track of this money? Why would we do that? Someone answer the question. Who wants to take a shot at it? Okay, so for the record, nobody wants to defend the fact that they are asking us to discontinue the use of outside...
So I don't know where that reference
Okay,
came
well,
from.
go
It
ahead, tell
didn't
us
come
why.
from the
Tell us
department.
why you think you can audit yourself better when you can't keep track of $5.5 billion.
I don't believe that came from the VA, sir.
Who did this come from? Okay, let me ask you this.
I'm not familiar with it.
Does anybody, okay, fine, I have 4 seconds left. Does anybody on this panel think that it's a good idea to let you audit yourself instead of outside folks doing it? Thank you, Mr. Chairman.
Mr. Arrington, you're recognized for 5 minutes, sir.
Thank you, Mr. Chairman. Sorry to come in late, and we've got a few hearings today, so today is a challenge to keep up, but this is incredibly important, and I just have a few questions, pretty broad questions for you. I guess, Ms. Park, I'll ask you, are you the senior-most VA official here today?
Yes, I am, sir.
Who's responsible for improper payments and reducing improper payments, managing, having a game plan, if you would, for reducing improper payments at the VA?
Sure. So we do have a structure of accountability for improper payments. Our Chief Financial Officer, Ed Murray, is responsible to ensure that we have an appropriate program to address improper payments. In addition to that, for every high-risk program, we designate a senior accountable official. So for all of our large programs with large improper payments, we do have a senior accountable official, and they are responsible for developing corrective actions, making sure that each year they're making progress on those.
Has anybody ever been fired for not managing the improper payments down as you describe, is the job description of those folks accountable?
So I would not be aware of that because those programs are within the agencies. We'd have to refer that to their Office of Accountability.
Okay, could you, I'm a new member, but I would like to get the answer to who has been and when was the last time somebody was fired because they didn't perform in oversight to manage improper payments down, that improper payments actually went up and they didn't achieve whatever the desired outcome, whatever the management goal. I'd like to know the answer to that question.
So if I may, I would like to say that part of the work that we've done is actually doing a deep dive to identify the improper payments. So that was very purposeful so that we knew what our baseline was for improvement. So in this case, I think that in some ways it's positive that we are being very open and honest about this, right, sir?
Yeah, I guess being open and honest is positive, but change in behavior and change in delivery and performance is the goal. So the VBA, VHA, NCA, I assume they all have heads. I don't know if they're political and career, but is there a political and career senior-most person at each of those bureaus?
Yes, sir, there are.
When's the last time somebody in those roles were fired because they didn't do their job to manage their financial affairs, in this case, improper payments?
Again, sir, I'm not aware of anything.
Could you give me the answer
But
to
we
that?
could take that back for the record.
So rank order, for me, the most important factor in not being able to manage improper payments better. Organizational structure, HR policies or policies that govern how you manage people, IT systems. I'll just stop there. Rank order the most challenging aspect to the desired outcome here based on those three.
I would say the IT system, sir.
And I understand there's a legacy system, financial management system that is in play to replace or to upgrade, modernize. Is that correct?
It will replace several systems, yes.
And how long will that take?
So we're looking at a 5-year plan right now, 5 to 8 year plan.
And how much money is that?
So this is our first year of really diving into this project, and our initial estimates with our shared service provider are about $400 million, but we do need to do a deep dive over the next 18 months where we're really looking at, I talked a little bit earlier about is we really need to pull this financial management information out of all these program systems, and we really need to do a deep dive into how much that is going to cost. So we'll be refining that in the next 18 months.
Did you mention how much it cost? I'm sorry.
400 million, sir. Okay. We are initial estimates without the work that we're doing over the next 18 months.
I appreciate your time, and I yield back to the chairman.
Well, thank you, and it appears as though we've got time for a second round, and I'd like to start the second round by yielding to myself for 5 minutes. Ms. Davis. Your report notes that the 24 biggest agencies only reported preventing $680,000 worth of improper payments in 2015 using the do not pay system. That number is astoundingly low, considering the billions and billions of dollars of improper payments that we are talking about. Why are agencies not using the do not pay system effectively?
Our audit of the Do Not Pay system, which was recently completed, determined that not all of the databases that the agency has access to are actually being used. Also, the databases are, the two databases that are most frequently used are the Death Master File and then what is commonly referred to as the Excluded Parties List, which is contractors who cannot do business with the federal government. The process includes payment integration, which is a process whereby Treasury's payments at the time of payment payment are bumped up against the payment flows of the various agencies. And if there is an issue of a potential improper payment, that payment is flagged, and then it goes back to the agency for adjudication. Now, there's a time lag there. So, for example, if it is determined upon adjudication that there is an improper payment, that can affect future payments or future flows of that particular stream of improper payments. For example, a benefit that goes on a recurring basis, you can stop future payments, but you cannot stop the improper payment at the time that it goes through the do not pay system. So there are limitations.
Did I hear you say on the front end that there are more system capabilities than being utilized?
That is correct. Yes.
So we got some folks using the system, they're just kind of cherry picking what they want?
Not exactly. There are issues with agreements in order to obtain the 6 databases that are supposed to be utilized, and those agreements have not been finalized, and those databases have not been pulled in by Treasury in order to utilize the payment streams that come from the various agencies. We've made recommendations, a number of recommendations to Treasury and OMB, including recommendations for OMB to look at its guidance in how agencies are utilizing the system.
So 2 of 6 are being used.
Correct.
Okay, how long
Well-
have how long have we been, we got 4 other possible tools out there that are not being used.
Yeah. Right. I would
How
say-
long has that been going on?
I cannot answer that. That's a question for the agency to answer. Now, I want to be very clear that there are certain aspects of some of those other data streams or databases that are being utilized, but they are not fully integrated. They're not fully utilized by the agencies. The only 2 that are being fully utilized are the ones that I just mentioned.
Okay, well, I guess it's fair then to Ms. Park, how is the VA, using the do not pay system now, and what are the plans to use more widely in the future?
Okay, so we have a really great partnership with Treasury. My team at the Finance Service Center in Austin works directly with Treasury. They meet monthly with them. One of the things that we found with Do Not Pay is that you really have to look at it you can't run all your payments through it at once. You really have to look at it from a program-by-program perspective, so that takes time. And that's what we're doing with Treasury right now, is we're going through each one of our programs with them. We're tailoring the Do Not Pay tool, and we're using it to not only improve the way Treasury does business, but the way we do business.
Okay. One final, more of a comment and with a follow-up. Ms. Park, I would be remiss if I did not raise an important and related issue. On the 14th of April, I requested purchase card transactions data from the DC VA Medical Center. So far, nothing has been provided. An environment with no inventory controls is the sort of environment where government credit cards could be misused. Can you estimate for me or tell me when the data listed in my letter will be provided?
So I was not aware of that request, but I will go back and I will get that to you in the next day or 2. I can get that pretty quickly.
Great, thank you very much. I yield back. Ranking Member Custer is recognized for 5 minutes.
Thank you very much, Mr. Chair. I think we still have some misunderstanding, at least for members of this committee and perhaps from the public at large, about the impact of our provider agreements on this dramatically inflated improper payment. People are getting the impression that there's improper payments being made that could be recouped, and you walked us through that. But would it be helpful? I understand that there's legislation that we have considered with regard to provider payments that could maybe take them out from underneath the FAR, so that we need to get to the reality. If there are, questions have been asked, if there are improper payments the way any layperson would understand that, too much money being paid or paid to the wrong person, vendor. But we are going to expend a tremendous amount of time and energy here on something that is not ever going to be recouped. And if we don't correct this going forward, we're just going to pass this on to future generations. I just want to get to the bottom of this at this hearing, because otherwise we are sending the wrong impression.
So I don't think there's an easy answer. That's always the case here, isn't it?
Well,
So,
I'm just trying to
yeah.
say, this whole testimony, with all due respect to my colleague about your, and by the way, this language, it has nothing to do with you. It showed up in the budget. It sounds like maybe it didn't even come through the VA, so that's another question. There's a mystery as to why it came to us. We have language in the budget asking that there not be an annual outside audit, asking that the audit be done internally. And we'd like to get to the bottom of the mystery behind this, but if you don't know about it, you're not going to be the person that can help us. But I'm just guessing that somebody has decided that calling these payments to our community providers, this is community care in our communities, rural hospitals, providing services to veterans, getting paid, and that's being characterized as improper because of a federal regulation that's typically in place when you have a different contracting system.
Right, so I think it would be good to revisit the Improper Payment Act and see if it's really,
Applicable.
effective, right? And especially the definition of the improper payment, right? Well, the problem is when you start talking about, let's move away from FAR-based contracts, you do put the veteran at risk because the FAR-based contracts do protect them in a lot of instances. So that's where, from my perspective, it gets a little dicey.
But I think, look, I can't speak for the secretary, and I can't speak for this administration. I just think it's duplicitous for them to pretend that we're going to recoup millions, billions of dollars. My colleague's talking about trillions of dollars. We're not getting that back. But hopefully, you can take it back to the secretary that colleagues on both sides of the aisle want improvement in the process of community-based care contracts that do not lead to this level of misunderstanding in an O&I hearing about trillions of dollars that may be recouped. That's all.
Yes, and we're working with ONB too on that definition. They're looking at revising some of their guidance too, and we hope that will have some impact on this.
Great. Thank you very much. Thank you for your service to our country and our veterans. I yield back.
Thank you. Mr. Poliquin, you're recognized for 5 minutes, sir.
Thank you, Mr. Chairman, very much. Just for the record, for my colleagues on the committee and for you folks right here, this is page 333 of the Medical Programs and Information Technology volume of the VA Budget Request 2018 Congressional Submission, page 333, where somebody at the VA requests, since you've hired more people at the VA to do this, you're able to better audit yourselves than have outside folks audit yourselves, and I would strongly disagree and will object to any effort to go forward in that regard. Let me ask you folks, I mean, you have an agency that you help run or connected with that has 365,000 employees. You have a budget of about $185 billion per year. And we're here to hear about the problems and seeing how the money's spent, where it's going, who's keeping track of it to make sure that we get every dollar we can to provide clinical services to our veterans and at the same time be fair to the taxpayers. So I'll start with you, Mr. Strum. You're there, I'm not. What's the biggest problem you see at the VA when it comes to financial management?
I would say it's my legacy systems and not being fully integrated between my business line systems and into modern financial.
Okay, so we know we've addressed that this morning in another hearing, is that the information technology, the IT systems, you have several of them that have grown up through the years, and so now the VA is in the computer software business, and I know you're about to replace that with one system that's integrated across all platforms. Is that what you mean?
Yes, sir.
Okay. Ms. Park, what's the biggest problem you see in making sure that we can keep track of all this money so we know where it's going, and to make sure that we help our veterans to the maximum amount?
Again, sir, it's the IT systems.
Okay. Ms. Davis?
I'm not in a position to address that question.
Okay. Ms. Davis, when you look at the financial management at the VA, you look, if I'm not mistaken, at different financial problems across different agencies, not just the VA. Is that right?
Correct.
How's the VA doing relative to the, well, how many different agencies you look at?
We look at numerous agencies. If you're
How many? 10, 15, 20?
many more than that.
Okay, 30, 40?
If you're talking GAO-wide, we can look at any agency. We have the ability to do that.
Okay, so I'm not going to get an answer, so I'm going to just say, I'll pick a number 30. How are we doing at the VA relative to the other 29?
Are you referring to improper payments or?
Yes, let's start with improper payments.
Okay.
The $5.5 billion, of improper
Correct.
payments that transacted last year.
Correct,
Yeah.
okay. The agency that has the largest amount of improper payments is HHS, and that's because it includes Medicare, the 3 Medicare programs.
So how's the VA doing relative to the other 29 agencies?
Well, if you want to look at the rate, we can refer to the rate, as I mentioned in my oral statement, that the rate for those 2 programs are 76 and 69%, and those are the highest rates government-wide. The next highest rate is 24%, and that's the earned income tax credit.
Okay, so if I understood this correctly, the VA is doing a poor job relative to the other people you're looking at?
I would not make that statement. I would only give you the facts that I have.
Okay, well, no, the facts lead us somewhere, right? You're in the responsibility, you have the responsibility of looking at multiple agencies. I'm just trying to figure out how the VA is doing.
Yeah. Well, and the numbers there, the total number for this past fiscal year was $144 billion government-wide, and a large portion of that, or not a large portion, but certainly a significant portion, is the $5.5 billion.
At the VA.
Correct.
Ms. Larson, thank you, Ms. Davis. Ms. Larson, what's the biggest problem you see at the VA when it comes to financial management, keeping track of all this money?
Sir, a lot of it is just that people don't take care of what they need to do when something's sent out to them, and then that creates their own issues. So then they ignore letters that are sent out to them, and then all of a sudden, the veteran calls and says, "What happened? How come I didn't get my check?" And I'm like, "Well, sir, you didn't respond to what the VA wanted you to do, or debt management, or whatever." And a lot of it is on their own accord, but yet I'm there to...
So it's the veteran's fault?
Oh, in some respects it is. Yep, and that's when they get kind of that, they call me and what can you do for me? Can you get me my money back? And I said, I'll try.
Do you think, given all of that it's a good idea to have the inside people at the VA audit themselves, which has been requested on page 333 of this document?
I'm really not one that would be able to answer that.
Mr. Dahl, do you have an opinion, if I may, Mr. Chair, of where the biggest thing we need to fix when it comes to financial management at the VA?
Well, I just would like to point out that, we are the independent auditors.
Good. I should have started with you.
We report, not to get into too much detail, but we report on the financial statements year after year. This year, we did have the 6 material weaknesses and the 2 significant deficiencies.
And do you do individual audits for other agencies, not just the VA?
No, we are the Inspector General. Our purview is any VA program.
Does any other agency in the federal government ask to audit themselves?
I hesitate to answer that because I'm not exactly clear on what
Do you think it's a
they're
good
asking
idea
to
that
audit.
any agency audits itself?
Excuse me?
Do you think it's a good idea that any agency requests to audit itself?
It may be a useful tool for them, but I would think that there would still need to be someone like the Inspector General or maybe a contract auditor to also come in behind that.
Thank you, Mr. Chairman, for the additional time. Thank you, sir.
Thank you. Mr. Arrington, you're recognized for 5 minutes.
Thank you, Mr. Chair. Mr. Dahl, you report to the Secretary, correct?
No, I report to the Inspector General, who is independent of the Secretary of the Department.
Who manages his budget? Who manages him?
I guess he has, oversight committees like this. I don't know that he really reports to anyone other
That's kind of how I felt when I was working in the federal government. I never knew who the OIG was accountable to, but I think they serve an appropriate role, and so I'm going to ask you some of the same questions I asked Ms. Parks. What do you see as the challenges? And maybe I'm reiterating a question and point that my colleague made about organizational structure. I saw that you made mention of the convoluted system and the lack of authority with CFOs. And so maybe start there, but just give me a comprehensive view of the breakdown and potentially even the dysfunction to managing for the desired outcome of reducing improper payments.
Okay. The organizational structure, from our perspective, is a concern. We don't know what the solution is, but we do believe that there needs to be more integration and cooperation within the department, that, you know, you have a CFO in the Office of Management, but then within VHA, VBA, NCA, they all have their own CFO structures, and VHA takes it even further with further levels of reporting. It probably is fair to say it makes it difficult for the CFO to pull together all that he or she needs to prepare financial statements every year. The folks from the department have mentioned the systems. The systems are certainly a challenge, but the systems are just a tool to get where they need to be. You know, VA's had challenges with implementing financial systems before. I remain guardedly optimistic that this solution will be more successful than the last attempt.
What was the last attempt to implement a IT system?
Well, they've had
failed?
Yeah, there's been a couple of high-profile systems, Core FLS and Flight, where I want to say that they've been mainly developed in-house, and they have not been successful, and that's why we still have FMS a quarter century after it started.
Yeah, it seems like we had a hearing on IT. It was one of the first hearings we had, and it just seemed like there was an agency-wide issue with getting the systems in place. They'd start and stop things. They'd spend millions of dollars on a project. They'd try to do it in-house instead of going off the shelf or custom. And it just was the most convoluted thing I've ever heard. There was no real architecture, enterprise-wide architecture, no sensible, well-managed IT system across the agency, it seemed to me. Is that fair to say?
You know, there's a lot of different users in the department with a lot of different needs, and I think that challenges the department, making sure that they can define and meet all those needs.
Is there a CIO?
There is. Well, there's currently, I believe, he's an acting CIO, but
Okay.
there is that position.
Who's accountable for ultimately for improper payments, the management of improper payments, or the poor management, or even good management, ultimately?
Overall, I would say that the Assistant Secretary for Management bears the highest level of responsibility.
And what's the senior-most career person that is responsible for?
I believe he's a career employee.
The Assistant Secretary?
For management, yeah.
He's
He's acting right now, so.
But if you weren't acting, would it be a political appointee?
I believe so.
So who's the career senior-most person responsible? Is it decentralized? Is it centralized? Who's accountable?
I think that I would have to have the department answer that question.
Yeah, I'm not sure who's accountable. Yeah. That's been my problem, quite frankly, Mr. Chairman, and just about every issue I have sat on this dais and listened issue after issue. That becomes my recurring theme: accountability. I'm never clear about it, and the results speak for themselves. And so, anyway, thank you for your time. I yield back to the chairman.
Thank you. Our thanks to all the witnesses. You are now excused. Today, we have had the opportunity to hear from an impressive panel of financial and audit experts. I hope everyone watching will carry with them a focus on managing the money after the budget is agreed upon. Partisan and interest group battles over spending get much of the attention. Internal controls are deficient is not a very good headline, but the nuts and bolts of financial management have a huge impact. This subcommittee will continue to monitor VA's progress in resolving the internal control weaknesses and deficiencies and eliminating the improper payments. Modernizing the financial IT systems is a major part of the effort, so the subcommittee is giving that special scrutiny. But obsolete IT is not the whole story, and organizational and procedural problems cannot be ignored. VA's financial challenges are hardly unique, but they are substantial, and I would like to be able to hold the department up as an example of sound financial management. I ask unanimous consent that all members have 5 legislative days to revise and extend their remarks and include extraneous material. Without objection, so ordered. I would like once again to thank all of our witnesses and the audience members for joining in today's conversation. With that, this hearing is adjourned.